All right, so today I've got Dr. Grant Chyz, a friend of mine and colleague of the Academy of Biomimetic Dentistry. If you don't know, my name is Matthew Miller. I'm the marketing director here, and Dr. Chyz and me, we just were talking for 30, 40 minutes about a whole slew of stuff. I want you guys to hear everything, but Doctor, please tell me who you are, what's your background, and then we'll just kind of go into what people can expect in this upcoming free webinar.
Sure, sure, Matt. It's been fun talking to you leading up to this.
Yeah.
Um, so I practice in Seattle. I've been practicing for 38 years, and I've always tried to lean towards tooth conserving dentistry. So that's before the term biomimetic dentistry was coined. Always trying to be less invasive. It's always been something I've valued, and I've embraced composite direct dentistry early on as a way to, again, preserve more tooth structure, especially when we remove amalgams and they're undercut and all of that. So it's been really amazing to watch materials improve, bonding improve. When I started out, we couldn't bond a dentin. We put Di-Cal. And then, we could, and it gets better and it gets better and it gets better, and shrinkage of our materials decreases. And so we get to the point now where we're using fiber in teeth or chopped fiber in teeth. We have bonds to dentin that are actually maybe better than enamel. They're great if we do it properly. We have the ability to restore teeth from within to nearly full strength. We have approaches to manage cracks, and we have approaches to do indirect restorations that have more sustainable bonds and better pulpal protection as well. So it's a really exciting time to be practicing tooth conserving biomimetic dentistry. And my focus for the upcoming webinar or webinars, because there's two of them that'll be upcoming, is on the primarily the direct restorations, starting with why we should care about this, why we should be maybe more proactive in intervening with teeth.
Can I interrupt you right there? Because you said something to me before that you said, I really want to convey, why does this matter? Why am I doing what I'm doing?
So we'll use probably an old chart, maybe by Richard Simonson, but looking at the idea that over time, teeth break down. So we start with a small filling. I'd like it to be no filling. Let's prevent that. Then as we get a patient that has a small, a medium, a large amalgam or composite or something that's failing or a lost cusp, what do we do, and how do we do that in a way that doesn't lead us down the path of tooth death, the cycle of degradation? How do we disrupt that path and steer into an area where we can preserve what's left in a healthy manner? And I think that's the central focus of biomimetic dentistry, is to try to preserve long-term tooth health. And that means at different levels of problem, which we don't get to choose. Patients come to us with these problems.
That's right.
And we have to restore them in a way that can help prevent further degradation. And if we're doing things for the first time, we also want to do that in a way to limit potential future problems from our treatment. So the
subject matter for our first webinar coming up is going to be, why does this matter? And your explanation of the tooth death cycle and how to maybe disrupt that and get in there and do biomimetic dentistry to change the future, right?
Exactly. Hopefully to change the future. If we can practice this way, we can change the future outcomes for our patients. And I will humbly actually start by showing just a brief example of a patient that I have been treated for 36 years, I think.
Now we're talking. So you're going to show some before and afters, maybe? Well,
I will show before and afters, but the why it matters for me, this one case strikes home because it's pretty traditional dentistry, even though maybe my crown preps were less deep and all of that. But it's somebody who started with me with a bunch of old amalgams. And then we see over all the years, the effects of all of those initial damaging restorations on his dentition over many,
Right.
many, many years. And studies that are 2 or 3 years long really don't show the effect of a lifetime. And so that is, my passion comes from not wanting to have that pathway followed for my current care. We know better.
So for people that are interested in learning more about this subject matter, could you try to wrap up in I know it might be difficult, but in a sentence or two, what they might learn if they come to this webinar, and why should they attend?
Yes. Well, they will learn a new way to look at teeth when they're going to begin to treat a tooth, a new way to look at it. And it's a disruptive way because it's looking at where is the existing good tooth structure. So they're going to learn that. They're going to learn the fundamental principles of how to manage that tooth from the standpoint of structure, cracks, and bonding technique. And then we'll do a couple simple fiber reinforced examples, which is the basis for doing more complicated teeth.
That's fantastic. The Academy is grateful to have you coming on. We look forward to this upcoming webinar, and we'll see you then.
It should be fun. I'm looking forward to it. Hope to see you there.